Hello, viewers and listeners. On today's COVID-19 update, Minister of Health Dr. Frank Anthony tells us that the Health Emergency Operations Center has commenced an exercise where they're visiting both public and private sector agencies to ensure that they're in compliance with the COVID-19 gazetted measures.
I think it has been going quite well over the last week. The HEOC would have visited at least 52 such businesses, and they're looking to see whether or not people are complying with the measures. Many of the businesses have not been in compliance. They have noted this. They spoke to the business owners, pointing out the deficiencies. And this week we'll be writing those businesses official letters pointing out that they're not in compliance and asking them, giving them a time period in which to get themselves in order. Hopefully, this would help us um, to improve the adherence to the measures, because without people adhering to the measures, we'll have a more difficult time controlling the pandemic. So I think last week's exercise with at least visiting 52 businesses, I think that's a success. We continue this week, and they'll be going out to other places. And apart from what is happening centrally, the police and the army have been going out to other areas, especially in the regions, doing similar things. So we hope that we'll get more and more compliance. In addition to that, you would have noticed that over the last week, a number of persons were arrested and prosecuted for violating these measures. We look at whether or not there are measures in place to limit the amount of people entering the business, um, sanitization measures, and of course vaccination, and asking for the vaccination card. So all the measures we are looking at. So when they visit, they have a checklist that they go through to see whether these businesses are in compliance.
Dr. Anthony explained that it is safe to take the second dose of a COVID-19 vaccine after recovering from the disease.
At the beginning of the vaccination program in February, when vaccines were really scarce, the WHO had put out guidance that if you were infected with COVID and recovered, then you should delay your vaccination. And they recommended at the time at least a 3 months delay. But that was in the context of not having enough vaccines for everyone. That situation has changed drastically in the world, and in particular in Guyana. We don't have an issue of vaccine shortage. So trying to prevent people from accessing vaccine because they've been infected, that's not our policy. So we have put in place a policy whereby anyone who would like to get vaccinated can come forward and get vaccinated. Now, if after your first dose you become infected, then we have to make sure that you have recovered so that you can get your second dose. So let's assume a typical and with each of the vaccines there are different factors that we have to look at. So the vaccines that we are using AstraZeneca. So the time period between first and second dose is between 4 weeks to 12 weeks. The Sputnik V time period between first and second dose, again, 4 to 12 weeks. The Sinopharm vaccine, that's 28 weeks. The 28 days rather, or 4 weeks. Pfizer, that's at least 21 days or 3 weeks. J&J, it's about a month. So these are the 5 vaccines that we're using. So let's assume that after you got your first dose, say AstraZeneca, you then got infected, maybe 5 days after. But within 10 days, you're recovered and you're discharged. So you can go and get your vaccine and you can get your vaccine within the appropriate time period. It doesn't interrupt your second dose schedule. And so for each one of the vaccines that you would have received as a first dose, these things would have to be calculated. So in some cases, it would have no effect at all on your second dose. And in other cases, it might delay your second dose a little bit. And that's what it is.
Here are the country's COVID-19 vaccination numbers to date.
As of today, 369,877 persons who would have received a first dose of their vaccine. That takes us up to now 72.1% of our adult population receiving a first dose. In terms of second dose vaccination for adults, we are now at 226,649. That brings us up to about 44.2% of our adult population. And with the administration of the Pfizer vaccine, we now have 25,998 persons who would have received their first dose Pfizer. That's about 35.6% of that age cohort. Two things there. One, if you're pregnant, you need to get your vaccine. And secondly, if you're HIV positive, you need to get the vaccine. So on both counts, there is a need, and if you have both conditions, then you better go and get your vaccine.
That's it for today's COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.